Okay, so we start now?
Yes.
Yeah.
Please.
Good evening, everyone. This is the third year of the Subcommittee of Women's Psychological Health of IPS Western Zonal Branch. I welcome you all. This time we are having a new team, completely new team, where myself, Dr. Khyati Mehtalia is the advisor, Dr. Dept is the chairperson, and Dr. Nimisha Desai, she is the convener of this committee. And we are also having 6 members. So now I hand over to Dept. She'll be welcoming you all.
Thank you, Dr. Khyati. On behalf of Women's Psychological Health Subcommittee of Indian Psychiatry Society West Zone Branch, I, Dr. Dept, welcome you all for today's program. First and foremost, I'd like to welcome our esteemed guest, Dr. Vinay Kumar sir, who is the president of Indian Psychiatric Society currently. It's my immense pleasure to welcome our own president, IPS WZB, Dr. Umesh Nagapurkar sir, who is also has a experience of 26 years of practice in psychiatry. I want to happily sir and Dr. Anjali without whose cooperation this would not have been possible. I also like to welcome our committee members, the convener, our convener, Dr. Nimisha Desai, EC coordinator, Dr. Hina Merchant, the other committee members, Dr. Nitisha Oza, Dr. Tanvi Pednekar, Dr. Dhruv Parmar, Dr. Megha Desai, and last but not least, all the guests who has taken out the time for this wonderful topic today. Thank you very much for joining, and I welcome you all. Over to Dr. Khyati for the inauguration program. Khyati,
please unmute.
Yeah, Vinay sir is on his way to pick his daughter. He said he would be joining, but maybe he is not able to join. Meanwhile, Umesh sir can talk. Let's see till then if Vinay sir can join.
Khyati, Vinay sir is already here.
He's already there. Dr. Vinay is there.
Then I am not able to see him.
He's there.
Khyati, Dr. Vinay is already there.
Okay. That is fine. Fine, then we carry on, Dept. You can invite Umesh sir and Vinay sir.
Dr. Vinay Kumar first.
Yes. Dr. Vinay, please say a few words for the session today.
No, sir. I request Dr. Umesh to continue to do it first. I'll settle down in 3-4 minutes. Then I'll be sharing.
Your daughter along with you,
sir?
Sir, you are already online, so please continue. Because
yeah. We know your time is precious, so please start. No. I was going to airport to pick up my daughter. She is also a psychiatrist.
Okay.
So matches with the theme of the today's program that we have to take care of, and we have to give chance, and we have to welcome women psychiatrists. So you start first. I'll settle in 3-4 minutes. Then I'll join.
So I request Dr. Umesh Nagapurkar sir, the president of IPS WZB, to share his blessings on this program.
Yeah, Dr. Dept, and I welcome you all. Dr. Vinay Kumar, president, IPS, all 3 panelists, Dr. Abhay, Dr. Anjali, and Dr. Minakshi madam, for this interesting topic. And I must congratulate Women Mental Health Subcommittee for choosing such a interesting and innovative topic for today's discussion. I won't spend much time because we are already late. So I request Deepti to continue this. Whenever Dr. Vinay Kumar is available, he can share his views and blessings. Thank you and all the best.
Thank you very much, sir. Sir, Dr. Vinay, sir, will you be able to speak now or? Sir, you are on a mute.
Thank you very much. Am I audible?
Yes, sir.
Yes, sir.
So, President of IPS West Zonal Branch, Dr. Umesh ji, and convener of this very unique program, Dr. Khyati Mehtalia. I'm really feeling inspired by such innovative program. And this kind of program inspires me to think that what IPS has done in this area. If we look back, we find that women psychiatrists have done marvelous job in almost all aspects of psychiatric practice. You see, they have served as teachers, they have served as researchers, they have served as leaders. I remember few names. I would like to recall few names like Dr. Sharda Menon. And I'm sorry, I'm still traveling and I'm on road, so some noise may be being going there. So I remember name of Dr. I would like to recall Dr. Sharda Menon, Dr. Deepali Datta, Dr. Roshan Master. All these big names have done a lot in the field of psychiatry and also for IPS. The IPS leadership needs. Dr. Indra Sharma was president of IPS. Women psychiatrists have contributed a lot. One change, I think you have rightly noticed that now we are. When I was on honorary treasurer of IPS, I used to receive lots of applications almost every month, and during that period, from 12 to 16, I started noticing the number of women applicants are increasing, and all young women applicants for membership from medical colleges, from those who are joining medical colleges student. So during that period, I started sharing in our group, and you see that it's a unique change that we see every month. We see gradually increasing number of women psychiatrists. And after some time, when I was general secretary and used to approve the membership status of newly applicants, even then I realized that things are much larger scale. So you have rightly noticed that more women medicos are oriented towards psychiatry, and so this is a welcome change. I remember last year there was a program on women mental health in Chandigarh, where I was invited in the capacity of vice president of IPS. And one thing I said there, that few years back, IPS reserved 2 seats for women psychiatrists in council. But a time will come when probably we will need to reserve 2 seats for men psychiatrists. So the way the number of women psychiatrists increasing is welcome. Psychiatry is all about compassion. Psychiatry is all about care. And if we see the history of humankind, we can say that so entire civilization has been cared with lots of concern and compassion by women. So the more number of women psychiatrists in IPS, or more number of women psychiatrists in India, is going to definitely better the treatment and care and all. One more thing I would like to add, I have led IPS in publication area when I was publication committee chair, and I experienced that whenever I requested any women psychiatrist to contribute, I always received chapters in time. I always received chapters well written. So I must appreciate, and I must tell this at this moment, that their more number and their presence in this in IPS and is going to make us more prompt and better society. IPS is planning to publish a book called India in IPS at 75, and I'd like to request Dr. Khyati Mehtalia that I have you have made me aware of this idea that West Zone branch is underlining this positive change. So I'd like to request to write a chapter on this, how this change is happening. And if you can do a survey for this, if you can collect some data, I think that will authenticate what you are saying today. So I request you to write a chapter for IPS at 75. The book will be published in. So with these few words, I appreciate West Zonal Branch, Umesh Nagapurkar, and this task force or subcommittee on women mental health by Khyati Mehtalia. I congratulate for this great initiative and the thing you have noticed. And I invite you for contributing a chapter in IPS at 75. With these few words, I wish you all the best. And I'm sure there will be a recording. I may not be, I will not be here now. I have to go somewhere. So I would like, I request Dr. Khyati Mehtalia to share the video recording so that I get all the discussions. After that, I can hear that. With these few words, thank you very much for giving me a chance to speak and inviting for this program. Thank you.
Thank you, Dr. Vinay Kumar, sir, for the kind words. And yes, the scenario is changing and it is changing for the good. So now I think we should officially inaugurate the program. Over to you, Dr. Khyati.
Please unmute Khyati.
Yeah, Vinay sir has very well set the context of this program. I request Dr. Nimisha to introduce the panelists and the moderator.
Okay. Good evening and thank you, Khyati. Yes, you are rightly mentioned that Vinay sir and Umesh sir rightly set up the platform for further discussion. And for that, we have the panelist, Dr. Abhay sir, Dr. Minakshi, and Dr. Anjali Chhabria, ma'am. So I'll introduce them. Please share the slide, the next one. Utkarsh, Mr. Utkarsh, please, next.
If it is not coming through, I will introduce myself.
Fine. No, sir. I will read. Okay, so our first panelist is Dr. Abhay Matkar, sir. He is a professor and head Department of Psychiatry, SDM College of Medical Science and Hospital, Sattur,
can the slide
Karnataka.
move just one ahead?
Yes.
Utkarsh, can you just click on the second slide?
Sir has a very vast experience in army as well as the teaching also. He worked in army as a medical officer and specialist as a psychiatrist for around 12 years. Sir is the professor and head since 2007. So really, it's really good to know the views as a academician, how the paradigm is shifting. Sir has the, okay, no issue, no issue. Sir has the interest area in the child psychiatry and the de-addiction. He has the awards also on his basket, many positions. Sir held the secretary in Karnataka in South Zone in Indian Psychiatric Society. Sir is also a chairperson of the Election Commission of the Indian Psychiatric Society. Is a direct council member and secretary and president of IMA Hubli also. And sir has other varied skills as a computer. He's a good sportsman also and motivational trainer. So I welcome you, sir. Our second yes, sir.
Thank you. Thank you.
Our second panelist is Minakshi ma'am, Dr. Minakshi Parikh ma'am. She is the director of the postgraduate studies and research in BJ Medical College, Ahmedabad. Madam is the professor and head of Department of Psychiatry in BJ Medical College. Madam has more than 40 journal, national and international publications. She trained more than 1,000 school teachers of Ahmedabad city in adolescent mental health. She has given many public lectures on various topics like stress management, women mental health, parenting, emotional intelligence. Ma'am is the member of Institutional Ethics Committee, also the in charge of the EG Center. She authored many books also, and her area of interest in adolescent, so Know Your Adolescent Students, one of the book. And the second book in a Gujarati, that is Tarunavasthane Samjo. Madam authored also the guidelines published by the government of Gujarat about the psychiatric illness, the standard treatment guidelines. And also, Madam attached with the International Association with the Analytical Psychology and Jungian Psychoanalysis. So I welcome you, ma'am. And we have our third expert panelist, Dr. Anjali Chhabria, ma'am. She is a leading psychiatrist and psychotherapist of India. She is recognized for her outstanding contribution to the field of mental health. Ma'am finished her MBBS from JJ Group of Hospitals in 85 and MD from Nair Hospital. She founded the Mind Temple Clinic. Anjali ma'am conferred the honor of being the youngest president of the Bombay Psychiatric Society in 2001. She served on the board of the Children's Society and is currently a director on the Salam Bombay Foundation. She is a regular columnist. She continues to write her regular contribution on the televisions, newspapers, magazines, radios. She has graced the panel on various television shows like Satyamev Jayate, has spoken at TEDx also. Ma'am conducts various workshops on mental health and emotional hygiene across schools, colleges, institutions, and corporate houses. She combines age-old traditional treatment like hypnotherapy with the recent one like RTMS and TDCS. Madam also authored the very interesting books. One is The Death is Not the Answer, which on discussing about the very sensitive topics of the suicide and provides the ways of the suicide prevention to the readers. Over the past 25 years of medical service, ma'am is the pioneer in encouraging the help-seeking behavior by reducing the stigma, breaking the taboos, and she's highly respected by the peers, clients, and the community. So I welcome you, ma'am. And it's really nice to have all of the three expert panelists with us. And we are looking forward for the most interesting discussions on this topic. Thank you. Over to you, Khyati, ma'am.
Nimisha, you also need to introduce the moderator.
Yes, yes. Yes, ma'am. And interactive discussion, we have the young, charming moderator and Dr. Khyati Mehtalia, right? She's a private psychiatrist, but she's a good academician also, along with the private practice. And ma'am runs the Sakhi clinic. She's also interested in the women mental health, and Sakhi works in the women's and child area in the Ahmedabad. And ma'am also wrote the various chapters in the book, multiple presentation in journal, national and international conferences. She got the Young Psychiatrist Award at national level, as well as many awards in state and zone. And she took many lectures on various topics like peer pressure, sexuality, relationship among schools and colleges. Also take the teachers training program for the adolescent issues. And ma'am is also a regular regular writer in newspapers, medias, and TV talk show. And on top of it, she's really a good singer. And we are looking forward for most interactive discussion along with you, Khyati, ma'am. Over to you.
Yeah, thank you so much, Dr. Nimisha. Now, since we are already a bit late, we will directly move on to the questions to the panelists, since we want to hear maximum from them. I'll start with Minakshi, ma'am. So, ma'am, since you are the PG director of BJ Medical College Civil Hospital, Ahmedabad, which is one of the largest and oldest hospitals of India, you have seen, what are your observations regarding the trend of females opting for psychiatry throughout these years in your department, or say our department, because I am also one of the product of the same department, and maybe in the other colleges also? What are your observations, ma'am?
So what I feel is that when we talk about trends, there's a definite rise in females opting for psychiatry. There's a definite kind of confidence in females in opting for psychiatry, a sense of safety and sureness that no, we can cope up. And all as a general trend, yes, more and more females are opting for psychiatry, barring a few odd years when sometimes, you know, there would be a batch where there would be a lone single female resident doctor. But overall, across all institutes of Gujarat and probably other states as well, the scenario that we used to have in our days of residency, where we had to look for female company amongst residents in psychiatry. We would be the lone female resident doctor. As compared to that, females have good company. And yes, the trend is definitely towards more females feeling comfortable opting for psychiatry.
Yeah, you're absolutely right, ma'am, because when I had joined, I remember out of the 7-8 residents, I was the only female, and female ma'am was that was you. So over to Dr. Matkar, sir. Sir, you have been a teacher in medical college from 1996. So that is almost 27 years from now. In this journey of 27 years, what is your observation regarding having female residents? Do you observe a change in it? Just like ma'am said, or what is it?
Okay. I would just like to take a step back. At the onset, I'd like to thank the organizers for choosing this topic and asking me to be part of the panelists. That's one aspect. The second thing, what I find is this whole issue goes a step back by saying that the inclusion or the joining of female students into MBBS itself has increased. And the numbers which we have 150 intake. And we find that 92 of them are females in our institution this year. So which is phenomenal, and which has been there proportionately that 70 to 80% of the students are female students. This is from the MBBS. So obviously what happens is the number of choice which they have from the clinical aspect also tends to increase. And then coming to the moot question which is now being asked, yes, there is a definite trend. And what I find is that there has been a significant change from being a subject of chance to a subject of choice. Unlike what my predecessor said that, I felt it was more of a defensive choice. But here what I find is in my students, at least in the vicinity which I come across, that it is more like an inclusive one. That means they come by choice into psychiatry, which is something which is very welcome. So I find that there has been a quantitative and qualitative change. If I am given a chance to talk about statistics, I'll come back again and talk about statistics also. Okay, thank you.
Thank you, sir. Now to Anjali, ma'am. I think you opted for psychiatry in 1985 or 86, which was quite earlier than now. So as a female,
right,
why did you go for psychiatry? Like, how did that happen? And were the people around you happy about that? Or can you just narrate so that it can be an inspiration?
Sure. So when I joined MBBS, and we'd had a psychiatry term, I felt, ever since I did that term, I realized that this is where I wanted to belong. And I think I was the only one organizing psychiatry clinics in JJ Hospital. And of course, when I finished my MBBS, it was a natural, I just want psychiatry. And of course, people all around me, all my family, doctor and my parents' friends who were doctors actually came home to dissuade my parents. The myth was कि ये खुद पागल हो जाएगी, इससे कोई शादी नहीं करेगा. So this was the kind of suggestions they were giving. And I was so scared that, that their pressure would win over my parents, that I had taken 4 other MDs and I had kept. So I had actually had 5 MDs in different colleges. Okay, but my first choice was psychiatry, is psychiatry, and will always remain psychiatry. So I'm very happy that, my parents said that, no, please go ahead and do what you want. And the same people who back then said, ki ye kya kar rahi ho tum, are the same people who said, oh, wow, I think you made a good choice, because everywhere you look around and need help. So, of course, it was a huge struggle, being a male-dominated field. I also I remember once I finished psychiatry and I applied for a job in a hospital and, reached the final round where there were 2 of us left. And they chose the male psychiatrist. And they just asked me one question, that if there's a violent patient, you're so petite, how will you manage him? So I just looked at them and I said, like, what? If you wanted a bouncer, you should have not called me here in the first place. So this was the kind of atmosphere at that time, So I actually, they told me that we are not giving you the job because you're a, woman. I said, I'm not going to do a sex change to get this job, So fair enough. And that's what we have, seen, going for conferences. I remember I would probably be one in 100 men, so of course, naturally, I have a lot of male psychiatrists who are my friends today because of this. But the stigma was definitely there,
And yes, and it is really good to know that now the things have changed drastically. Like there are everywhere female psychiatrists. So coming to Minakshi ma'am, in your journey of 30 years of teaching field, what do you feel has changed? Why are females now opting for psychiatry more as compared to before?
Yeah, so continuing with what Anjali ji was saying, see, many things have changed, but I think the change began with Philip Pinel and the movement of deinstitutionalization. And with the advent of better psychopharmacology, safer and options in treatment, somehow that fear of violence from patient is obsolete now. So that is one thing that has definitely changed, that we have better and more feasible options of treatment and better chances of giving improvement to the patient. That's one thing. And of course, along with that, the stigma has gone down. So the younger generation, in contrast to the older generation, is much more inclusive in its thinking. You know, it's inclusive. It's so comfortable talking about mental health, and it is so comfortable talking about mental illness as well. You know, depression hua to kya? So what? Is it a crime to talk about it? So that is in the air, that is in the collective. More and more, the younger generation in particular is more and more accepting of mental illnesses, of suffering it themselves and going for treatment, and also supporting their friends who are passing through that stage. So that inclusiveness, that is also something that has changed. You know, now people do come to ask before taking up psychiatry, but we face this question less and less. Will I be stigmatized? Even I'll tell you one thing, that female residents ask this question less than male residents, that जो psychiatry लेते हैं over a period of long time, वो खुद भी पागल हो जाते हैं क्या? Do the negativities of the patients affect us? These questions are going down in frequency and intensity. So, and the care has become more patient-centric. The care has become more holistic. These days, in spite of so many advents in psychogenetics and the biological aspect of psychiatry, there is an equal increase in the discussions of therapy, in the discussions of the social aspect of psychiatry. So it's more holistic. It's more the old model, the biopsychosocial, wherein you take into account all the aspects that are factored into the causation, maintenance of illness, and the improvement and the maintenance of improvement. So there are a lot of changes going on in the overall scenario of the mental health.
Thank you, ma'am. Abhay sir.
Yeah.
Why do you think females choose psychiatry? Initially, females chose psychiatry less, and now what barriers are decreasing according to you?
Yeah, actually, I start with from where Madam left. Actually, the issue of stigma is the major issue as far as choosing is concerned. Then the early arrival of a patient to consultation, that's also something which we have seen over a period of time. What I used to see is, in the first 5 to 10 years of my patient, those who used to come, they were florid patients who were basically chronic schizophrenics with exacerbations over a period of decades. That was what was the initial. They come at the early phase, the identification at the local level that this is psychological and it needs help from a psychiatrist. That has improved. That is one thing. Secondly, as again, Dr. Anjali said that, for a patient who is violent, do you need a boxer? Those much earlier phase. The third thing is what I found is that it goes by the word of mouth as to how this subject is. I find that, initially the choice was something that it was something like a cold subject, that isme koi emergencies nahi hai, and then they felt that, it's more of a 9 to 5 job. But as trainees, we have ourselves gone through, and most of us have gone through, is that it does involve that your involvement has to be more, and you do get calls. There are emergencies and all that. But I also find that by choice they come. If I'm allowed to give an example here, my own institute also, like we have started now post-graduation for almost 11 years now. And in this 11 years, what has happened is that we have had 3 students who have come back to us from undergraduate levels to do post-graduation in my institute. That was by choice, though they could go anywhere in the country. This I felt very heartening to even share it with all of you. And I find that only in the last 3 years, 2 of my students have chosen psychiatry, but they could get seats outside my institute. So that is something heartening. So that it means it is more of a choice rather than a chance that they are choosing it. And it's a very good sign. And ultimately what we want is that the number should not just increase. It's just that the outreach of the psychiatric facility, the outreach of our program, like being psychiatrist, that you are able to help patients with mental illness or any other suffering of psychological nature, is far more than what it was before. Okay.
Yeah, Anjali ma'am, you said that thing कि भाई psychiatry लेके कोई शादी नहीं करेगा. I had a similar experience when I was doing my internship in my HOD of medicine as well as HOD of surgery, both told in different ways that you should not take psychiatry, otherwise you won't get a good husband, something. The surgery person told me that कोई भी अच्छे घर के लोग ऐसे नहीं चाहेंगे कि उनकी बहू पागलों की डॉक्टर हो. So this was how they were seeing female psychiatrist at that time when I, Dept, we all opted for psychiatry. So now, do you find any difference in the treatment towards you by other medicos, your colleagues, even your patients? So how is your experience in the professional world now?
I think we are actually moving to a gender equal world, and things are changing. And of course, definitely now I've been in the field for more than 30 years, and people respect you. But of course, many a times, even when they introduce you at lay places, they may say, "Oh, me, Dr. Anjali, is a psychologist." So they're still calling you a psychologist.
Yeah.
Okay. So now I've actually given up on that, and I'm also I think the introduction that you got today was for the lay people. So that's why it was a little bit, I was a little embarrassed when you all were talking about it. But that is basically my way of converting what psychiatry means to lay people, So just to explain to them that this is a medical branch where there are treatments available for mental health disorders. And I think a large part of my journey has been making the community aware, in different forms. So, of course, I think there's no dearth of respect. People respect you as they respect, anyone who is working in the profession. They respect you for your hard work. They respect you for your commitment to the field, and they want to partner with psychiatrists to make the world definitely a healthier place.
Yeah, thank you.
So I don't think my gender comes in the way.
Ma'am, you are a celebrity. So anyways, you're above all the psychiatrists in many ways.
Please don't say that. Everybody is doing such wonderful work.
No, but that you are definitely. Yeah. So Minakshi ma'am, being the head of the department, there will be many interns coming to you for taking the guidance of whether to choose psychiatry or not. Can you share the concerns of females thinking of joining psychiatry? As you said that now nobody thinks कि हम खुद पागल हो जाएंगे, but still, do the females have any particular concerns?
So here I think we've already discussed the concerns of stigma and facing violent patients, and these are all things of the past because psychiatry has kind of moved out from the asylums to the general hospital psychiatry. It's very much a part of the established general medical setup. So no, those are, I mean, the concerns. And females, as Anjali ji was saying, it's they have also moved beyond their traditional roles and kind of they have gotten in touch with their own assertiveness and found a place in this world moving towards gender equality. And so most of the concerns are same as the male doctors, that how would it be after completing the course, what are the scopes. And sometimes we get this student who says, my parents are trying to dissuade me, but this really is a field that I feel is my path. Yes, I feel I want to go there, but my parents are saying no. But those are not very strong. And I do tell them that, in fact, the way things are now, psychiatry needs females, because females definitely are more in touch with femininity. Femininity may not be, females may not have the exclusive copyright over femininity, but definitely more than males. And the qualities that we need in a good psychiatrist: empathy, openness, approachability, these are the forte of women. So it is one of the favorite questions they ask me is, have you ever regretted taking up psychiatry? And I can so authentically say that no, never. I haven't ever looked back, or haven't ever felt the need to think that, did I take the wrong branch or what? So this is how people come, and this is how they are reassured.
Ma'am, when I joined psychiatry before that, I had approached Matkar sir for that I had heard that another lady professor was a patient had tried to throttle her. So I was actually scared by that. Otherwise, I was very much wanting to take psychiatry. So when I asked that question to him, what he replied was, but she's still alive, na? So you can take psychiatry when you will be alive, nothing like that bad will happen.
Yeah, the patient could have tried to throttle a male resident doctor as well.
Yeah. So, Matkar sir, I particularly, Abhay sir, I particularly wanted to ask you, I saw your CV in which you had mentioned that you have served in army for 12 years. I think few years as a doctor and then later as a psychiatrist.
As a specialist, yeah.
Yeah. And army typically has less female doctors. Again, that gender stereotype. Can others be muted? Yeah. So army typically has less female doctors. That is a general impression.
Yeah.
And even lesser psychiatrists. So what was your experience, your comments on that?
Yeah. See, basically, when I started my career in the armed forces, there was only one lady psychiatrist. We had 20 centers in the country. As of now, there are 35 centers in the country. There are 82 psychiatrists. As of now, there are only 8 female psychiatrists. But here comes the big news, that amongst the 37 PGs who are doing training now, 13 are lady psychiatrists, postgraduate students. So you see, suddenly there has been an influx of all the lady candidates doing psychiatry. So all that which was happening for so many years with the meager number of lady psychiatrists has now suddenly changed. Now, mind you, the families of the armed forces always needed support. but that was never recognized. And unfortunately, that was how it percolated into only 8 lady psychiatrists in the country till date. And now there will be, out of 37, 13 are going to be appearing for exams in a few years of time. And those will be serving the armed forces. So there's a phenomenal change as far as statistics is concerned in the armed forces also. The same is, as Madam also said, it does reflect in the civil services also, even in Ahmedabad and in other places. You see the same statistics that at least 60% of them are lady psychiatrists. So this trend is something which is quite important. And then as you see that more number of lady people are going to join the armed forces, which are already there, more number would be joining. So more primarily will be requiring the services of service psychiatrists. So would be the family members who already are there who needed psychiatric help. So that trend is also improving. And these are, mind you, there is a difference in the choice of subjects from the armed forces and the civil. In the armed forces, it is by choice only. That means they choose it, they appear for an exam, which is first general, and then a few issues related to psychiatric questions, and then they get selected. So this is very heartening to see that the number is increasing, and so would be the quality of care also would improve in due course of time. Thank you.
Yeah, so the trend is increasing in all the areas, psychiatrists, doctors, armed forces, everywhere. Now, I can see there are two, I think, most senior female lady psychiatrists, Savita ma'am and Hemangi ma'am. Savita ma'am, are you there? Savita ma'am was there, right? Has she left or? Okay, fine.
Savita ma'am is not here.
Okay, okay.
Yeah, I think she's not here. Yeah.
Yeah, Hemangi ma'am, are you there? Hemangi, please unmute ma'am. Hemangi ma'am.
Hello. Hello.
Yeah.
What you want, my experience?
Yes, ma'am.
I joined psychiatry 52 years back.
Oh, that's
and that time there were hardly any psychiatrists. I remember hardly in Maharashtra at least 2 or 3. And there was a lot of opposition from the family because my father was teacher and his own students were doctors. They also told him, all psychiatrists go mad. So don't allow her to take up psychiatry. So I really wasted 1 year. I did one medicine post, then I did one post psychiatry, and then Dr. Lulla, she said, anyway, you are doing post now, then why don't you do diploma at least? That way I did. Then he said, diploma be MD. That way I completed. But that time, one senior psychiatrist has told me, if you want to take up psychiatry, you have to have watertight compartments. Like whenever you are with the patient, you will really get involved with the patient. You will not have sympathy, but you will have empathy for the patient. So you will understand what he is undergoing. But once the patient is out, or once you are out of your clinic, forget about everything. And if you can do that, then you will not get stressed. So I asked my student, I was in Nayar, HOD, then Somaya, and I see many lady, means girls as a resident. So I asked them, what is the situation now? And majority of them, they say, madam, still we get opposition to join psychiatry from family.
Oh, still now.
Yeah.
So, Khyati, I
yeah.
would just like to add something. I'm very happy that Dr. Hemangi Davle is there because, you know, when I joined Nayar, she was there. And there was one more lady psychiatrist who's in Australia now. And we would all laugh because all 3 of us would get dabbas from home, which were prepared by our mother-in-laws and given it to us. Ma'am, you remember this?
Yeah, of course.
Yes.
Of course.
You know, so of course, it was also the support of the women in the family, you know, who kind of did not discourage us and also encouraged us to, go ahead.
Okay.
Yeah, but
And
this was
I'm
before my marriage. When I
Yeah. But I'm saying that if you remember this, when I
yeah.
was your student, that was the support that we had.
Yeah,
Yeah.
and again, I'm happy that Savita ma'am is again here with us. She is, I think, I really don't know who is more senior, Hemangi ma'am or Savita ma'am, but at least they both are quite senior to us. So Savita ma'am, I would like to.
I think age-wise, I think I may be senior to her.
Okay.
Okay. Hi.
Savita,
Good
how old
evening,
are you?
all. How old I am? I'm fossilized, ancient. I'm 72.
I'm 76.
Okay. Wonderful.
Oh,
So good.
okay.
So good.
Yeah,
So,
nice to see you, Savita,
Very
after a
nice
long
to be
time.
here among friends here, and I listened to the debate discussion so far. Just sharing my experience. I joined psychiatry in 1974.
okay.
My residency time was 74 to 76. Many of you were not born then. And when I joined psychiatry, my father was a doctor himself, and he thought that I should take up gynae, more suited for girls.
Well,
Where I chose psychiatry, and my teachers in medical college, all my professors, because I was a university topper in the Shimla Medical College, and they said that what has gone wrong with you? You are going to PGI to do this. You could take any other subject, and which actually I could, but I chose psychiatry by my own personal choice. But my department in PGI was so great under Dr. N. V.K. Verma. They made us feel absolutely special, and really they took care of us, pampered us, and we had a very good and very thorough, although very rigorous residency training program. But we were very much taken care of, loved, and looked after. I suppose women in psychiatry, I would think that the women are natural carers. And what has happened over a period of time, gradually, more and more women are opting for medical career. Now, in the changing scenario in the current system, where boys are opting for engineering and management courses and field careers, and girls have kind of moved on to greater amount of, because they have moved away. So the girls are more in medical college as the medical career. And in psychiatry, again, what has happened is that the stigma around the subject has decreased. Definitely, it has come down. The concern about violent patients, that has come down, because we hardly see those very severely sick and out of control, violent, chronic, deteriorated psychotic patients. They have become very less and less common now. And like people who were visiting a psychiatry wards in PGI, and they would think, even my family, when they came once or whenever they came to the ward, they said, you can't make out that this is a psychiatry ward, because this was like any other normal ward, people moving around, patients and relatives and everything, and no halla gulla happening, nothing happening. It was like very normal. That has changed, and of course our knowledge base has changed considerably about psychiatry. And women, I think somehow it's taken to be still a softer branch amongst all medical specialties. Like neurosurgery would be very hard, orthopedics would be very hard for girls, and but psychiatry, so to say, in many ways is taken as a softer branch, equivalent of pediatrics, and but gynae is again very demanding. And this has been there. And as far as my journey in psychiatry has been concerned, like at the personal home front, my after joining the field, I did my MD, and then after completing my MD, I was a faculty when I got married, and then I enrolled for PhD. And my mother-in-law was so supportive, is absolutely great individual person, that she took care of the house and me and my children and everything. And she was so proud of me when I completed my PhD. And so what I'm saying is that the support from the family, when we have to excel and work professionally, And in such a demanding and such a kind of engaging career and schedule, your support from the family, your husband and other family members is extremely important and necessary. Only then it becomes possible for us to really move on in the career and progress further. This has been there. And overall, I have not faced, I think, gender discrimination. I have not actually not faced gender discrimination as it is. It's a more kind of a gender neutral world, as Anjali says. But I think somewhere still what we find is that although women have changed in their perception, in their role, in their responsibilities, in their presence in the field, I think there is some degree of change that is necessary on part of men, because I still feel, and I'm saying it on a platform and with some kind of a trepidation, that I think they don't feel so comfortable in the company of professional women. I mean, I'm talking of professional, at the professional level. I'm not talking at the personal level. That is a very different kind of a relationship or equation. I'm talking absolutely about the professional relationship and circles. I think the level of comfort across genders one sees is little less. I mean, that's what I have felt. I have felt that men folk, they are happy and amongst their own, the men together, and women. There is somehow there is a categorization and separation of genders that happens even at the professional level, which to me seems little ununderstandable and unnecessary. It's not needed at all. I think we could be equally comfortable and with each other at the professional level, and kind of share jokes and kind of enter into debates and discussions, and everything can take place.
Yes, ma'am. I completely agree. And what I've observed, like the discomfort.
That's it. That I would say.
Yeah, the discomfort which the older generation had, which we have, the younger generation is not having that discomfort. And I see both the genders gel very well with each other. So it was very nice, Savita ma'am and Hemangi ma'am, to hear your inspirational stories. So again, we move back to our panelists. Minakshi ma'am, as a professor, you have nurtured so many students. I was one among them who are now practicing psychiatrists. So how do you see the place of female psychiatrists in the society? And like, what are the advantages of being a female psychiatrist? Ma'am, you can hear me? Minakshi ma'am?
Yes, thank you for asking that question, Khyati. So, I can hear you. Yes, am I audible?
Yes,
Yeah. So already one of my resident doctors, she recently did a fellowship in reproductive psychiatry at NIMHANS.
Wow.
So female psychiatrists on one hand, and on the other hand, psychiatry for female patients. Both of these are developing fields. Men and women are definitely different genetically, hormones-wise, socio-culturally, experientially, value-wise. Men value things, females value people. So their ailments are also going to be different, and therefore this developing branch of reproductive psychiatry or female psychiatry. And as female psychiatry, we have a lot of strengths which support this profession. We as females, and as Jung would say it, we are more in touch with our inner life. We are more in touch with our own emotions. We have a natural gift of understanding the psychodynamics, our own as well as those of the patients. And therefore, it is easier for us to feel empathy. Therefore, it is easier for our patients to open up to us. Also, it would be easier for us to understand perinatal psychiatry, all the postpartum depression or postpartum blues or even postpartum psychosis or premenstrual syndrome, because of, there is an inherent validation that we can offer to our patients just because we are females. Even rape victims and victims of domestic violence and all of those would feel naturally more comfortable talking to a female psychiatrist. And I had a comment with from one of my male resident doctors that thank God there are female resident doctors in our department. So we can, kind of give these kind of difficult patients to female resident doctors. So, but anyway, so, and then continuing it from, understanding patients to even treating them. Females, I think therapy is more a forte that demands femininity. I do not say that males cannot do psychotherapy. And as Jung says, that each one of us, each female has an inner masculinity that we need to dig out from within ourselves and claim, just as each male has inner femininity, which it is the task of the second half of life to, kind of dig out and claim. So when I'm talking about this qualities, it is the femininity, which is more the province of females, and therefore females are more comfortable with it early on, even from a younger age. But I definitely feel that moving towards holistic care, understanding female patients, and even sometimes male patients feel more comfortable talking to female doctors and treating them. All this is very much a field that females feel very comfortable in. And I'm sure there's a lot of progress that I see in the foreseeable future. So kudos to female psychiatrists.
To all of us. And I hope that all the male doctors won't
and
mind
all the
listening.
men who support us. No, they wouldn't mind us. It's only with their support that we can progress. And as Savita ji said, it is
of their support, or in spite of their support.
No, cases can be different, but I definitely agree with Savita ji that it's only with, but then their inherent support and backing is something that really, is the backbone of our progress.
I can see Abhay sir laughing as if he wants to say something. So I'm not going to him right now. I'm going to Anjali ma'am. So Anjali ma'am, as I said previously, you yourself are a celebrity. You are a psychiatrist of celebrities and your favorite choice of the media people. So do you find any differences in the way media sees you and other male psychiatrists for talks, sports, etc.?
So, as I said earlier, they look at you as if you're going to counsel more. So you're more of a psychologist in their head, and I also find this a little bit challenging, when I prescribe medication, people will say, oh, no, we only want you to counsel us. Now, the same patient, yesterday, I had someone who called me up and said, you convinced my wife to take medication. She didn't take it. She got offended. Okay. And now she's gone to your colleague, a male colleague, and she's taking medication. So I said, as long as she's taking medication, that's fine. And, I think all of us, I think there are more celebrities in life today. And I think all of us are treating celebrities, wherever we are. But I think our job is to even educate people about mental health, whether male or female.
Yeah.
Because
definitely.
how we see we are losing people. Yesterday another very tragic event happened. There was a senior doctor who messaged me and says, my niece has attempted suicide. Can I please call her to see you? Okay. I said, sure. She said she stays out of Bombay, and she said that, I'll call her after 2 days. And before I could, this morning I messaged her. I said, listen, I think you should call her today. I'm very uncomfortable when young people. And why did she attempt suicide? Because she did not make it for the NEET exam, And when I messaged her today, she said, as we were talking, she completed her suicide.
Oh my God.
So yeah, it was really, really sad. And, I was feeling terrible about it. I said, I should have just, kind of reached out to her. So I think there's a lot of work that we all need to do, men, women, and we need to use all the celebrities we know, catch them and make them talk our subject. Okay, because it's only then when things are going to change. So sorry, I'm just digressing a little bit, but I think that's really important.
It's important, very true. So, Abhay sir?
Can I say a minute?
Ma'am.
Just a moment. Just on Anjali's point, I think somewhere there is so much stigma against psychotropic medication in the society. And it is more in the higher economic, socioeconomic status, not so much in the lower socioeconomic status. I mean, low socioeconomic status patients, you prescribe medication, they agree and they take. Higher ones, they think that you can do kind of a magic by counseling and things. And they also think that the psychotropic medications are wrong or bad. They may be taking anything else, so many other things, intoxicants and things in their life. But psychotropic somewhere is kind of, is very, and whereas I think that psychotropics now are so effective and so life-saving and life-changing medications that these should be, we need to work really hard to kind of allow psychotropics to be kind of accepted by people
absolutely,
in a major way. And our psychology colleagues, I think many a times also kind of say things against medication, which is not right. It should not be
ma'am, it's not our psychology colleagues. It's right from the pharmacist.
Pharmacist, correct. I was saying the same.
To the family doctor.
ऐसी दवाई नहीं लेनी
चाहिए.
Even
right now, I'm dealing with a celebrity couple. Okay, where both the husband and wife are Maharathis in their own right, and they're both depressed. Okay, and they're both refusing to take medication, and of course going to alcohol, etc. And I'm wondering when one of them is going to jump off, and again it's going to become national news for 15-20 days until we all forget about it.
Very true. And very sad.
Even chemist tells them these are sleeping tablets. Whether you do antipsychotic, antidepressant, anything that is sleeping tablet, don't take for long.
Yes, ma'am. So Abhay sir, coming to you. So, like very open-handedly, I'm asking you, what is the message or something which you'd like to give to the audience, to the people, young residents, young interns?
From my own institute and from other institute, a lot of undergraduates and interns have logged in. And I find that this is one of the which one can really opt for by choice rather than by chance. Because there are a lot of things which the myths which were there, the issues related to stigma have been now overcome. So I think they can really look forward to an exciting career. And I find this is one of the most fascinating subjects of medical science. Unlike all other branches where, you check the blood pressure, you say it is hypertension. You check the blood sugar, you say diabetes. But this is something where, your own inputs are more important than what the patient says. And based on what the patient says. I find this is more of an inclusive science, which is quite exciting, and we can do a lot actually. And I really recommend that it is at par with all the other branches of medical science. And I'm sure a lot of students, interns and postgraduates will really excel and do well. And our primary motive basically should be for patient care. And with more number of psychiatrists, I'm sure patient care will definitely improve. So I think more and more students should take up psychiatry.
Yes, sir. So it
Thank you.
is, thank you, sir. So it is a very interesting discussion with all the panelists plus our senior most lady psychiatrists. But I think since now we are running short of time, we would like to end that. So if there are any questions, 2 or 3, we would like to take that. Anybody would like to ask questions? Meanwhile, in the chat box, we can just see. Dr. Nimisha has commented, many interns asked is whether we can manage or regulate our emotional health while working in psychiatry. I think yes, the first change that occurs when you are becoming a psychiatrist is within yourself. And yeah, so anybody would like to ask any question?
May I, Khyati?
Yes.
So this is to all the panelists, or maybe Dr. Minakshi ma'am can say. So when we were searching for this topic, I just read few articles on this topic. So I came through one of the articles which said that more female are opting psychiatry because out of their own need to control their own stress, people are choosing psychiatry. So what is your take on this, ma'am?
So great if people are thinking that psychiatry will help us reduce our own stress, then that definitely answers the question asked to Nimisha by this intern, that, and it definitely kind of defies the original assumption that people will go mad if they take psychiatry. It's exactly opposite, that people have started thinking that if we take up psychiatry, we'll be better able to handle our own emotions and our own stresses. And in a way, I do agree with that, because as Khyati said, the first change that comes is within ourselves. And so definitely psychiatry equips us to kind of normalize our stresses, to kind of be open about our stresses, kind of be accepting of the minor anxieties and low moods, and not be secondarily anxious. Why am I going through all this? We feel, okay, it's all right. And we've seen so much suffering that there's a kind of desensitization, in the sense, a normalization. It's all right, everybody has problems. So what? That's not the end of the world. And we can always find solutions if we talk about it, if we express it, if we opt for solutions like psychopharmacology plus and or therapy. So yes, that's my take on it.
Thank you, ma'am. So now I would like to request our president, sir, Umesh sir, to make a few concluding remarks.
Yes, thank you, Khyati. And I think it was a interesting, engaging discussion on this very novel topic of female psychiatrist. I think I have seen this trend in medical college over here also. In last few years, the number of female PGs have been more than male PG students. I thank Dr. Vinay Kumar for giving blessings and important thoughts regarding this important issue. I thank all the panelists, Dr. Abhay, Dr. Anjali and Minakshi Madam, for their wonderful elaborations. I thank Khyati and all the Women Mental Health Subcommittee team of Western Zone. I think the time has changed from a single female resident in psychiatry department to now we see many female psychiatric residents, and this is welcome. And as Dr. Abhay has said, the subject of it is not a subject of chance, but a subject of choice now. I know many female medicos, interns coming to us and asking whether to join psychiatry because they feel that it is less demanding, less stressful. There are no emergencies as such. But I would definitely tell them that even though it is less demanding, but it is a very fascinating subject and it gives you an excellent, exciting opportunity to serve the mankind like any other medical branches. And as Dr. Anjali has said, the stigma has been less now as compared to a few years back. And now we are moving towards more gender equal world, and female psychiatrists also getting respect because of their hard work and commitment. And as Minakshi madam has said, that female psychiatrists have more empathy, more openness, and they are in touch with their own emotions so that they can understand the client's emotion very well. And I hope that this discussion would encourage more female medicos to opt for psychiatry in future. Thank you, everyone. Thank you very much. Over to you, Khyati.
Yeah. And now I would invite Dr. Tanvi Pednekar, who is a member of our subcommittee from Goa, to give vote of thanks. And before she says so, I would like to thank her for making the beautiful flyer which was sent to you all. Thank you, Tanvi. Over to you.
Thank you, Dr. Khyati. On behalf of Women's Psychological Health Subcommittee, I feel immense pleasure to propose the vote of thanks for today's program on an innovative topic, a very thought-provoking session that we have had. I would like to express my sincere gratitude to our esteemed panelists, Dr. Abhay Matkar, Dr. Minakshi Parikh, and Dr. Anjali Chhabria, for making us aware about the different aspects of this paradigm shift, whether it was the reduction of stigma, the gender equality, the awareness due to the inclusive of mental health in the younger generation, and the support that we female psychiatrists have got from our family. I would like to also thank Dr. Khyati for moderating the session. I would like to take this opportunity to express deep regards to Honorable West Zone President, Dr. Umesh Nagapurkar, as well as Honorable President of IPS, Dr. Vinay Kumar, and Dr. Dhananjay Ashturkar, Honorable Secretary, for gracing the occasion with their presence and for their constant guidance, support, and encouragement. I would like to thank the Gujarat Digital Academy for Mental Health for hosting our event. Last but not the least, I extend special thanks to each and every one of you who attended and participated in today's panel discussion with great enthusiasm and made it a success. Thank you very much.
Thank you all.
Thank you.
Thank you.
Yeah, so.
Thanks a lot. Thanks a lot, Dr. Khyati. Thanks a lot, all the organizers. Thanks a lot, my co-panelists. Thanks a lot. Okay,
Thank
bye.
you. Good to know
Good
you,
night.
Dr. Matkar, Dr. Anjali.
Thank you.
Good night,
Thank you.
everyone.
Bye-bye.
Good night.
Good
Good
night,
night, everyone.
Thank
It
you.
was very nice with all of you.
Thank you, Dr. Dept, for having conducted, and Dr. Khyati, of course. You summed it up and conducted it very well. Thanks a lot. Bye-bye. Good night.
Thank you very much. Thank you very much.
Good night.
Bye.
Good night.